Hi, my name is Dr. David Benversi. I'd like to share with you the most common causes of scoliosis. Now, before we talk about the most common causes, I guess I'd like to tell you just a little bit about scoliosis. Scoliosis is any time in our back that we have an abnormal curve or an excessive curve. And a lot of times we'll see this either from standing from behind someone and be able to see a curve going side to side, or even if we're standing from their side and looking at them from a side view, we'll be able to see an excessive curve. Now there's 4 different types of scoliosis that we're looking at. The first one is genetic, then we have traumatic, we have idiopathic, and we also have hormonal. Now the genetic scoliosis that we're referring to, a lot of times is more prevalent in females, and a lot of times we'll see malformation or possibly what they call a hemivertebrae, where one of the bones in our back isn't formed as well as they could or as well as it's supposed to be, and it doesn't look like a normal bone. Another thing that we can see as far as genetic wise is we can have one leg that is even shorter than the other and give us that scoliosis as well. The next thing that we were talking about is the traumatic, and this can be something as far as an auto injury or even sports injury, and we can even see this in people that have osteoporosis, where those bones are being compressed and we have a compression fracture, and that'll cause a scoliosis as well. The next thing is the idiopathic, or basically it means that we really don't have a cause or a reasoning for the scoliosis, but it's there. And lastly, we're going to be talking about the hormonal. And a lot of times we'll see the hormonal scoliosis in females that are pregnant. And basically what happens is our body secretes a hormone that causes the ligaments to loosen up so that your body can accommodate and shift around to accommodate for the birth of the baby. And after the baby is born, a lot of times those ligaments will tighten back up and the scoliosis will be corrected. Now, the most common things or problems that we see with our patients that come into our office with scoliosis is they have increase in pain, they also have increase in muscle spasm or tightness, and they also have a decrease in range of motion. And in severe cases, we can actually have the scoliosis where it will encroach or press upon some of our organs in our body, and those are the more severe stages of scoliosis. And with the 3 first mentioned symptoms, as far as the pain, the muscle tightness and spasm, and also the decreased range of motion, typically when we see those type of patients in our office, there's a couple of things that it really affects throughout their day and what they can do. One of the main things is it affects how they're able to work, not only how long they're able to work, but how well they're able to work and the performance that they're able to put into their job and do what they want to do. The next thing that really affects is their activities of daily living. And what I mean by that is really just their personal hygiene, their ability to do the things that they want to throughout the day, as far as be able to wash their hair, put on shirts, be able to tie their shoes, things like along those lines. And lastly, we see scoliosis as far as decreasing your ability to sleep. So not only your ability to fall asleep, but also to stay asleep, and then most importantly, the quality of sleep that you're getting through the night. So if you're having pain, we'd love to help you. Please give our office a call at 618-519-9334.